Hello everyone, you are all welcome to Alveoly E-learning. Alveoly E-learning is a non-governmental organization that supports the learning of students across the country. This tuition is purposely for Alveoly E-learning students and anyone interested in health education only, and should not be replaced with textbook or classroom tuition. We have already done simple tutorials on the introduction to the nursing care plan, as well as how to write the patient problems in association with the patient strength in the previous videos. So kindly watch them if you haven't. In this tuition, we are going to look at how to formulate the nursing diagnosis from the patient problem, as well as the objectives, outcome criteria, and nursing orders. So let's begin with the formulation of nursing diagnosis. The formulation of nursing diagnosis must always go with the patient problems that you wrote. Nursing diagnosis is always written as problem in NNDA, related to what you think is the probable course of the problem. For instance, if you have a patient who is unconscious and cannot bath, then patient problem becomes patient cannot bath, and let's note that bathing is a form of self-care deficit. This implies that the patient is deficit on things that he or she has to do for him or herself in terms of self-care. Other things which are included in self-care are oral care, feeding, hair and nail care. Hence, in our scenario, our patient was an unconscious patient and our problem was patient cannot bath. Hence the nursing diagnosis becomes self-care deficit of bathing related to unconsciousness. If the patient was conscious but weak in bed and needs assistance to bath, the patient problem becomes patient cannot bath without assistant. Hence, nursing diagnosis becomes self-care deficit, assisted bath, related to general body weakness. Now let's have a look objective of outcome criteria. This part indicates what objective that you have set for your patient based on patient problems and the outcome criteria that can be used to determine if you have met your objective. Your objective should be SMART, that is 1. Specific, 2. Measurable, 3. Attainable, 4. Reliable, 5. Time-bound. For instance, in our previous scenario for the unconscious patient with a problem of patient cannot bath, the objective will be patient would be bed bathed within 1 hour, which makes it fall under SMART. This is because it is very specific. We are only going to do bath, which can be done or attained within 1 hour, hence time-bound. Our outcome criteria will be as evidence by nurse observing that patient is clean and neat in bed. Hence, if anyone comes or an examiner sees that patient is clean and neat in bed, it's a form of evaluation to see if you have achieved your objective. Hence, in our scenario, our objective, the outcome criteria becomes patient would be bed bath within 1 hour as evidenced by patient looking clean and neat in bed. For the nursing orders, it must be written straightforward and taxable. When I say the orders must be taxable, it means that it must be written such that it will indicate or provide at least one task for you to do to be examined on. For instance, in the scenario for the unconscious patient of which the problem was patient cannot bath, the nursing orders may include 1. Reassure patient that he or she will be bed bathed. 2. Perform bed bath. 3. Change soiled linen from side to side. 4. Treat pressure areas. 5. Groom and make patient comfortable in a simple occupied bed. So from the above nursing orders, you can be given 1. Bed bath as your task. 2. Pressure areas as your task. 3. Changing of soiled linen from side to side as your task. 4. Simple occupied bed as your task. Please always remember, when they give you your care plan to do, you are supposed to end at nursing orders only. Then after you have been given your task to do and you are done with your task, then you request for your paper again, and fill the intervention and the evaluation part. Please note it very well. End of tutorials on how to formulate patient problem, strength and nursing diagnosis made easy for practical exams by Alveoly E-learning. Please watch the subsequent videos for more examples on various patient problems with their corresponding strength, diagnosis, objective outcome criteria, and nursing orders. Your comments and questions are welcome. Please subscribe, like and share Alveoly E-learning YouTube channel link. Call or contact the course instructor on +2335 4955 6116 on WhatsApp for further tuition and explanation on any health tutorials. Thank you.